Hey guys, so I just wanted to give you guys an update, and I'm actually just gonna combine this with another video, um, just so it won't be so long. That way I can only post one. So I just wanted to give you guys an update from my previous video regarding my appointment with my oral surgeon today. So I went in, and what he basically told me is that my bottom left wisdom tooth was really close to the nerve, and he showed me on my x-ray, and it was very close to the nerve. The roots were actually touching the nerve. So he said that he was actually able to see it when he went in to extract it. So he has very high hopes that it is only bruised, that it's not permanent. He did run some, he did a couple tests. He had me close my eyes, and he grabbed like a, kind of like a Q-tip, but like the wood part of it. And he had me close my eyes, and he just kind of like had me tell him in what direction he was going. And he said that I am feeling the sensation because I did get him correct. And then today actually, I know that I had told you guys in my previous video that I was feeling like tingling, and I am, like, today it's like tickling. So I'm crossing my fingers, and he had me schedule an appointment in a week to go see him to see my progression. But he did mention that it could take a couple more days, or a couple more weeks, or even a couple months, which is what I do not want to hear. He also told me that my upper left wisdom tooth was really close to like my sinus cavity. So he actually ended up leaving a piece of my root, like one little piece of my root. So he said if I ever get an x-ray taken, and if they tell me, hey, did you know you had this or whatever, to let them know, yeah, my doctor left it there. He told me that he did not want to go back in there and try to take it out because he just didn't want to do some type of permanent damage, especially because of it being so close to my sinus cavity. So I'm like, you know what? I asked him if, it would harm me in the long run. He told me no, that it would become part of like my bone. So I a million times prefer for him to leave it there than for it to cause a problem. Now I'm still talking funny, and the muscle, it does feel a little more relaxed today right here. But when I eat or talk, it does still feel tired. Not as much as yesterday, so I think I am getting a little better little by little, and I'm hoping that I will recover 100% soon. You don't really realize how much of like your face muscle and your chin muscle you use when you speak and when you eat. So it has been affecting me in that way, especially right now that I'm talking, recording this video. It's like I feel the tension right here and right here. So just wanted to give you guys a little update, and I will make another video soon to let you guys know.
Hi guys, it's Erica.
Thanks,
I just
guys.
wanted to
Bye.
do a quick update on my wisdom teeth extraction. Today is Wednesday, January 27th, 2016. I had my wisdom teeth removed on Friday, January 8th. So in 2 days, it'll be exactly 3 weeks from my surgery. Like I said in my previous video, I had 3 of my wisdom teeth removed. 1 on my upper right, 1 on my upper left, and 1 on my lower left. My right side, I had no issues on that side, but my left side, after the following day after my surgery, I continued to stay numb, and it was like that whole entire week after surgery. It was a horrible week. I cried about it. I went to go see my oral surgeon the week after my surgery, and he basically showed me on my x-ray how my that wisdom tooth, the nerves, the nerve that comes across your jaw right here, that tooth, the roots of it was basically touching the nerve, and he was able to show me on my x-ray. So he told me that he doesn't think that he damaged the nerve. He just thinks that it's really bruised because of how close the root of that tooth was. So he wanted to see me again at 2 weeks to see how I was doing at that point. That second week of recovery, what I started noticing is that my lip and chin felt as if I had fallen down and scraped that whole area, and it peeled like a layer of skin. It's weird. It's hard to explain, but I had a lot of tingling and burning sensation, and that's how it was that whole entire week. Then, when I went to go see him, he told me that that's all part of the healing process. He does think that I will regain full feeling, but that it will take time. He wants to see me back in a month to see if I've progressed. This week, I've felt as if I am regaining feeling, but it's not 100%. In some areas, it still feels mushy. And that muscle tension that I was talking about in my previous video, I still feel it, but it's not as intense and as strong or as painful. It's very, very tolerable. I can still feel it, and throughout the day, I'll forget about it. So, in my opinion, I do feel like I am getting better. I just know it's going to take time. He told me that the nerves take time to heal and regenerate, and it can take several weeks to a couple months. And like I said, I no longer feel this area super mushy. I can feel that I'm touching it. It's really weird, and it's very hard to explain. I know that I don't have full feeling 100%, but I am starting to feel like my lip area. I feel it, but it's almost as if the feeling is altered. I don't know if that makes sense, but it doesn't feel normal like it would when I'm touching this area. So when I touch this area, it just feels like the sensation is just times 5 or 10, if that makes any sense. So I hope this helps. For those of you that just had your wisdom teeth extracted and you are having the same symptoms as I was the first week, I would recommend just don't think about it so much. I know that that's easier said than done, but really relax. Don't stress about it. Just wait a week. Let time do the healing, basically. It does take time. I will make an update video in a couple weeks to let you guys know how I'm doing then. But like I said, I do feel like I am getting better. I don't have 100% full feeling yet, but I have high hopes. Hopefully this helps, guys. If you guys have any questions, feel free to ask. I'll go ahead and answer them. Thanks, guys. Bye.